To the Point with Michael Williams.
The story behind the story of how a deputy came forward to tell about guarding convicted sex offender Jeffrey Epstein while he was on work release. And one of the keys to finding out how sick our insurance system can be for some patients. Good morning and welcome. I'm Tory Dunnan in for Michael Williams, and we hope you've had a great Thanksgiving weekend. We're going to do something a little bit different on today's To the Point. Rather than talking about politics, we're going to talk with a couple of our Contact 5 reporters about investigative journalism. We're starting with a story that has been in the news quite a bit this year. It's about Jeffrey Epstein, but this is an insider's look at his work release while serving his sentence in Palm Beach County. A sheriff's deputy who guarded the convicted sex offender more than a decade ago came forward to tell about the things that he saw. Contact 5's Maris Badcock has a story you saw only on News Channel 5.
What some say happened in this West Palm Beach high-rise haunts a Palm Beach County sheriff's deputy.
Could it have happened when I was supposed to be monitoring him? Yes. Yeah, that kind of tugs at your heartstrings.
This is the first deputy to come forward to the media with information about Epstein's time under PBSO's watch.
Why are you doing this interview anonymously?
Because I've seen it firsthand, the sheriff's office is very vindictive.
This deputy was one of dozens in charge of guarding convicted sex offender Jeffrey Epstein while he was out on work release in 2008.
He was cordial, but in the back of my mind, I know why he was there. I knew he was a convicted sex offender.
The deputy says the difference in Epstein's work detail was in the details themselves.
For starters, when you signed up for that detail, it was a plainclothes detail. And that almost never, ever happened.
So what else was unusual about this work detail?
That he was allowed to leave the office and go to his residence to have lunch. I've never ever been to a detail where that was allowed to happen. We were to follow his vehicle in our own sheriff's issued vehicle. I was told when he went to his house to stay in the driveway. So I don't know what happened behind closed doors when he went in his house and allegedly had lunch. You know, he could have been doing anything he wanted to during that time frame.
So you have no idea what happened inside that home?
No. That's one of the reasons I stopped working the detail.
The deputy says they also weren't allowed to monitor Epstein past the reception area inside his business suite at this downtown West Palm building.
I was just told to sit at the front. You have a log. Just log in whoever comes into the office.
But when Contact 5 asked for a copy of the visitor log, PBSO records told us it was destroyed, according to their public records retention schedule.
It sounds like the smoking gun right there that's highly suspect, especially the sheriff's office where they keep records of everything.
The log would help prove whether or not Epstein was allowed to have contact with anyone outside the scope of his business.
I think the reason that the log is gone is because it would hurt the sheriff's office, not the victims.
At the request of the sheriff's office, the Florida Department of Law Enforcement is currently investigating the way PBSO handled Jeffrey Epstein's incarceration. The financier, who's been accused of sexually assaulting dozens of underage girls, only spent 13 months in the Palm Beach County stockade, 8 of them out on work release.
Who was working in his office?
Look like 20-year-old females, well-dressed, business attire.
Did you think that that was strange, given the nature of his crimes?
Yeah, well, I thought it was strange that besides me, myself and Mr. Epstein, we were the only males in the office. I remember I took note of it mentally.
Last month, 2 women came forward in New York City lawsuits with claims they were forced to have sex with Epstein while he was on work release, supposedly under the watchful eye of a sheriff's deputy.
Do you know anything about that?
Could it have happened? Absolutely, because he wasn't really in an environment where he could be monitored completely the entire time.
The sheriff's office declined any interview requests, but sent us this statement in part. The allegations are factually untrue and or inaccurate. Due to the ongoing criminal investigation that is being completed by FDLE, no other response regarding these allegations will be given by the sheriff or PBSO. Despite the fear of retaliation, this deputy couldn't stay quiet any longer, knowing what might have happened inside this high-rise haunts others too.
And I only pray that when I was working this detail that it didn't happen on my watch, but I'll never know that.
The deputy told me there were never rumors about women being forced to have sex with Epstein while he was on work release, at least not until those women came forward with new accusations. But because Epstein was unmonitored most of the time, sources tell us deputies are now afraid it happened on their watch.
So, Maris, obviously we can't get into the specifics about this particular deputy, but for viewers, I think they find it interesting. How difficult is it to get someone to come forward in a story like this and tell their story? It's controversial.
Absolutely. It can always be extremely difficult, especially if the subject matter is controversial or difficult to talk about. But I think at the end of the day, it's really important to have people at the center of the story you're profiling, on the record talking about it. Our storytelling is in our DNA. We share stories, we learn from stories, and so having people at the center of these stories discuss what happened to them is, a way that we can learn as a society.
And do you find that it's sometimes their mind is already made up? They're going to talk or they're not. It's hard to convince someone either way.
I do think that people go in thinking, why should I communicate with you? What do I have to offer? What's the point of me talking and sharing my story? And so oftentimes it's a matter of figuring out that part, maybe it is worth them sharing. And sometimes we approach somebody and we learn that it's not appropriate and there really is no reason to do so, and we move on to the next person.
So this story has been all over the news. We know it got its start in Palm Beach County. It's now really international. What has it been like to be sort of the center of the story?
I think the biggest challenge we've had is staying organized, because there are so many tentacles to this story. National, international, even multiple states are involved, federal investigations, criminal investigations, civil lawsuits. So it really takes a village of reporters, I think, covering different angles so we don't miss something and we can try and get questions answered.
Especially at the local level, when you also have networks who are covering the story and have a team that's 5 times the size, right?
Exactly. You're really see what network is made of and what local is made of. And local news, there are certainly stories in the Epstein saga that are stories for local news reporters, questions that our local viewers have. And, obviously there's also stories that nationally other people want to know too.
Would be interested in, yeah. So what do you think might be coming up in this story, or is it just hard to say because it's taken a lot of turns?
I can't predict the future. I wish I could. I do hope, though, that the women who say they were abused and assaulted by Epstein, that they find justice. I think that's really important, and that's one of the reasons we've been digging so deep into this story. And I also think locally there are still some questions as to how this was allowed to happen. So I hope that we can find answers there, too.
What are you doing in particular, without kind of, revealing what you can't reveal, but what are you doing to stay on top of this story?
Well, we have a list of stories that we want to tackle, a list of ideas, a list of people that we want to talk to. And we, have been going down the list, asking for the records, asking for the interviews, and profiling and compiling a bunch of different segments in the hopes of not letting go of this story.
Okay, thanks so much. We'll be talking more with you in just a few minutes. But coming up next, a Contact 5 investigation into medical costs. Fighting cancer, a hospital and insurance company. Coming up, a Contact 5 investigation into medical costs. Welcome back. We're talking about investigative journalism. In our Contact 5 series, A Sick System, The Cost of Your Health, we've shown you billing errors, outrageous emergency room costs. In one of the stories, we focused on a woman fighting cancer who says the healthcare system failed her. Contact 5 investigator Wanda Moore explains.
I was diagnosed May 15th of last year.
A diagnosis that shook Lauren Greaves to her core. Stage 3 breast cancer.
It had spread to my lymph nodes, so I had all my lymph nodes removed. I had both my breasts removed.
Before she could start with chemotherapy and radiation, she had to make another big decision. Her doctor said the treatment would wipe out her ovaries.
So they're like, you need to freeze the eggs. You have 4 weeks, go.
The procedure isn't cheap, costing $30,000, and it was not covered by her insurance.
I don't know who has $30,000 laying around, and it's either you do this in this 4 weeks and you figure out this money, or you don't have children and you have 4 weeks to make this decision and find this money.
When it came to fighting cancer, Greaves thought she knew how much she would end up paying.
All of my visits had been covered. I'd gone and gotten biopsies, mammograms, sonograms. Everything was covered, and my deductibles were paid, and I paid my out-of-pocket, and we were fine.
Then she realized
they wouldn't pay for anything, not a dollar of it. So I'm halfway through chemo. I'm half dead, literally, and I have $100,000 in medical bills that aren't paid for, period.
Greaves was stuck in the maze of medical billing. She says that her insurance did not accept the way the hospital was billing.
There's no way that somebody could do this to someone. It has to just be an error. It's a billing error. I'll talk to people, they'll figure it out. And everybody I talked to just passed me off to another person and another person and another person. And I was spending hours in circles on speakerphone just crying and trying to talk to somebody that would just listen to me. It was pretty devastating. It was worse at one point than the actual cancer.
She was drowning in medical debt.
And there's nothing you can do. I couldn't stop chemo. I would have died.
And she turned to GoFundMe.
And I'd look through and I'd read, some of the messages people sent me and the crazy amounts people would give that didn't even know me and had never met me. Sorry.
Lauren received more than $76,000 in donations so far, but her medical bills are around $200,000.
The diagnosis I could fix, I could work on, I could be proactive, I can go see doctors, I can get things done. The billing and insurance, I can't, get 6 jobs. I can't, make $100,000 in 6 months.
A year after she started treatment,
I get probably 10 to 15 bills a day.
She's still fighting the hospital and the insurance company.
7,000, 6,000, 3,672. Just bills you don't expect to see when you have insurance.
Do you even know what these bills are all for?
No. My sister and I went through a lot of them one day and went through all of the bills and codes and tried to understand. They try to make it very confusing for you, so you just end up giving up and paying them.
She said she got some charges reversed, like a $20,000 injection she was billed for twice by accident.
To have to deal with that while you're also dealing with, your own mortality and your family's stress and your parents' pain, and trying to deal with that and trying to figure out your insurance is just, to me, it's extremely traumatizing. It was a very dark time.
Greaves is considering legal action to fight some of her medical bills, all while fighting for her health at the same time. It really shows you the impact of healthcare billing and how it's gone wrong, basically.
I assume you had a lot of different stories to choose from when it comes to this topic. How did you pinpoint which ones you were going to cover and which you weren't?
Well, we actually started by looking at just medical bills in general and started to look. Now we have people send in medical bills, and so then we can work on those and then look, well, is this really an issue or is this not? But in the beginning, especially with her, she was actually the first story that I've done. I went to GoFundMe because I know that a lot of people, they turn to GoFundMe if they can't afford their medical bills. So in a way, GoFundMe now is one of the largest insurance companies in this country.
Because it's helping people pay medical bills. Interesting. So what was the biggest surprise that you found while covering these stories?
I think it's that the fact that this is an issue that's impacting people from all different walks of life, and everyone is almost in the same boat, struggling with these transparency issues from hospitals, with the insurance companies, with incredibly high medical bills. And they always feel like, oh, it's just me. They feel isolated. And then when you bring out these stories, they're quickly to say, well, absolutely, that happened to me as well. We just had a gentleman who had an $8,500 lab test. And he just didn't ask, well, is that lab covered by my insurance? And is that test covered by my insurance? Things that you don't even think about when you are just going to a doctor that's in your network.
I assume that it's pretty difficult to get these stories in, and then with HIPAA and everything to kind of verify what you're looking at is true. I mean, did you have a lot of difficulties?
Yes, it is tough because you need to become almost like an expert in medical billing yourself, and that's what you just heard Lauren Greaves explain as well. Like when she went through her own medical bills, she had to understand medical codes and all that. So same for me. I'm sitting there with all these medical bills and need to make sense of it all. And then, as you mentioned with HIPAA, of course, we need to ask them before we can even ask the hospital or whatnot that they fill out these forms. So it's definitely a long procedure, so to speak.
Sure. All right, so Maris, we want to bring you back in because we're going to talk a little bit about the job of being an investigative reporter. And I think for the viewers, it's interesting to them to understand the difference between general assignment and being investigative. Both of you have worked general assignment before. So can you talk a little bit about the differences?
I'd say one of the biggest differences is time. As an investigative reporter, you have the luxury of a little bit more time. You're not on the grind, feeding the beast, so to speak, as we like to say. So for me, that was definitely a luxury that I was not afforded when I was in general assignment.
And it also, I think it just takes time, meaning when you do records requests, very often there's just not a story there, it doesn't pan out, but then you went through all the effort and looked into the data and whatnot. So it just takes a lot of time to actually find the good stories and then make them work.
I think one of the biggest differences between them is, as a general assignment reporter, oftentimes you go home, the day is over, your story is done. Next day is fresh, but you guys bring the story home.
Absolutely, and you never stop thinking about it because it's like it's constantly this until it airs.
Right.
You constantly think, well, did I include that? Should I bring this up? I mean, there's a lot of pressure on you as well.
Well, and even after the story airs, oftentimes you're looking at doing follow-up pieces and staying on top of it. So it really, you're dealing with subject matter that kind of never dies and it's always evolving.
What would you say the most difficult part of working in the investigative realm is?
Well, for me, I think it is that very often you do all that work, all that research, find people that you need to talk to, and then in the end it just doesn't pan out and it's not a story, and then you need to start fresh. So it's very often that, well, it's not a story and you have to start all over again.
Yeah, there's truly a lot of time spent behind the scenes, digging and truly investigating and running down sources, and oftentimes you'll never even see any of that work that went into the TV piece. So you could spend hours and hours on something. So I think that there's a misconception there sometimes that it's maybe more glamorous than it is, but it's difficult, but it's rewarding.
That you're not doing anything. Right. I'm just kidding. On the flip side of things, what do you think the most important or the best part of being an investigative journalist is?
For me, it really is holding powerful accountable and helping people in the community out, and I think that's why investigative journalism in local news is so important, because we're here to hold your government accountable. That's not something that's going to be done by, the national media or anyone else. So that, for me, is the most fulfilling part of it.
I completely agree with Wanda. I think that giving a voice to the voiceless and holding the powerful accountable, it sounds cliche, but it's cliche for a reason, and I know many of my colleagues get into journalism for those reasons, whether they work the daily beat or they're an investigative. So whatever we can do to give a voice to our community.
Do you have, can you paint sort of the picture of what a day looks like for the viewers?
It just so depends. It's
it depends what you're doing.
Yeah, and I mean, that's the same for general assignment reporters too, but I mean, like it could be a day that you just spend going through records. I mean, I've spent 4 months on one story once. I mean, you just take a lot of time to go through everything. You read 300 pages of documents, and then the next day you are running around doing interviews. Like every day is different, so it's really hard to say what a typical day looks like, I think.
Absolutely, no, I second that as well. You never know what it's going to bring. It's a little bit more structured when you're working general assignment, because at the end of the day you're expected to be on air with a story, and so that measure of success is a little bit different when you're investigative, but yeah, every day is different. It's one of the most rewarding things about the job, and then one of the most difficult things as well, because you're trying to balance your life, and it can be tough.
And how do you get your stories? I mean, it's probably similar to general assignment, but yours have kind of a different bar to meet, so.
Right, yeah.
We rely a lot on our tip line. That is super helpful. Oftentimes, it's about making connections in the community. We're reading through headlines and newspapers, going through lawsuits and records requests, taking a story that maybe a general assignment reporter did and asking the next question and trying to figure out how we can develop it further. There's a lot of different ways to find stories, but it can be difficult, as Wanda said earlier, to find the right story. Your time is valuable, and so you need to pick wisely.
What do you think the biggest misconception about investigative journalism is?
I don't know, that's tough. I feel like investigative journalism is often a little bit overlooked or lumped into with everything else, that people don't really differentiate, well, this reporter's investigative, this one is not. And I think there's a little bit of investigative in every reporter, right? I mean, it's asking.
Why a lot of people go into it.
Correct, absolutely. So, but I think the biggest misconception is how much work really goes into it, and how much we balance everything and really look deeply into all these different issues. And I think a lot of people just assume, well, we asked and then we just assumed and we just put something out there.
Mm-hmm. Absolutely. I second that as well.
Well, it takes a special kind of person to be able to do investigative as well. So thank you guys both for coming on and talking with us. We do want to, you mentioned the tip line, so we want to get that information out there. If you have a story idea for the Contact 5 investigators, you can reach them by calling 561-653-5717, or you can send an email to contact5@wptv.com. And of course, you can remain anonymous. Thanks again, and we'll be right back in a moment. Thank you for spending time with us on today's To The Point. If you'd like to send us your comments about today's broadcast, go to WPTV.com, click on the To The Point page, and you'll see a section to send us your views. Enjoy the rest of your day.